Actually, I never chose glaucoma as my first choice. It is otherwise. The glaucoma chose me. What happened was, I did my comprehensive ophthalmology fellowship from LVPEI Institute with subspecialty training in pediatric ophthalmology. And after the fellowship, I was practicing strabismus, pediatric ophthalmology and adult cataracts and pediatric cataracts. And I was very happy doing that. But as the circumstances would have been, I came into contact with Dr. Vikas at around 2010 or so, where he asked me that whether I can manage his squint patients. I said, why not? So while I was seeing squint patients, he also showed me a few glaucoma patients also. I said, okay, I'll see them, because I had some exposure to glaucoma during comprehensive ophthalmology fellowship. So I started seeing the glaucoma patients, and that is how I started seeing glaucoma. But I found glaucoma patients to be very, very challenging. Every patient was different. So I started reading more about glaucoma, and I found it to be very, very interesting branch. Slowly my glaucoma practice, it partook the strabismus practice. So now almost 80% of my practice is glaucoma, only 20% is the strabismus. So that is how I shifted to glaucoma, and I'm really enjoying what I am doing right now. So every day there are a lot of situations while managing glaucoma that bring glow into my eyes. I will just discuss two of them. One is managing the intractable glaucomas. The patient comes to us, he is having severe pain, he is symptomatic, or he has a lot of allergy due to anti-glaucoma medications. His IOP is not getting cured, lowered in spite of surgeries, in spite of all the medications. His eyes are red and he is in severe pain. Many a time such patients say they ask for evisceration. So I ask them, just give me a chance, I will put a tube in your eye. If the IOP, if you do not become symptomatically better, I will eviscerate for free. And after putting the tube, the wow factor for me that brings glows in my eyes is that when the patient asks that now my strain is over, when am I going to get my vision back? So that is the moment that brings glows into my eyes. The second situation is whenever a patient has been told elsewhere that he or she has glaucoma and he is really worried, and he comes to me, I do all the tests and tell them, okay, you do not have glaucoma. So the moment, the change in the facial expression of the patient, all his worries disappearing in a moment, so that really brings glow into my eyes. Glaucoma requires three qualities. One is the compassion, the other one is patience, and third is communication. So I think these three qualities in me, they make me suitable for practicing glaucoma. Compassion, because all the patients are suffering a lot, and if you show a little compassion, almost 80% of their symptoms are relieved. The other thing is patience, because many a times your treatment does not go the way you want to be. So in that case, you have to be patient and just keep on waiting till the time your treatment starts working. And the third is, and the most important thing, is the communication. If we communicate to our patients properly, they can be really very, very compliant, and your treatment will be really effective if you communicate with your patient properly. There are many challenges that I faced while practicing glaucoma. In the initial phases, I had never watched tube surgery being done. For me, glaucoma was only timolol and trabeculectomy, and then switching to the most complicated patients, seeing them, managing them, it was a challenging and Herculean task. Slowly I read a lot about glaucoma from the journals and the articles. So whatever I was reading, I was seeing in front of my slit lamp. Those patients were live sitting there. So that is how I kept on learning glaucoma. I still remember my first tube surgery. The first patient I did tube upon was who had a UGH syndrome and an intractable glaucoma. So the moment I put tube, the next day IOP was perfectly normal. The eye cornea was shining, and that patient who was suffering for say maybe 5 years, suddenly all his symptoms were relieved. So I got my wow factor in glaucoma, and that is how I went deeper and deeper into it. So my advice to postgraduate students would be, first of all, you should never think that you know everything. So always clear your mind of whatever knowledge you have and always stay zero. Because if you stay zero, if you know that you do not know anything, then you will make an effort to know something. And you can learn from your colleagues, you can learn from books, you can learn from patients. So every patient, every situation is a learning opportunity. And glaucoma will give you plenty and plenty of learning opportunity.